Good afternoon. My name is Linda Cathay, and I am a proud student at Widener University. The purpose of this video is to present a case that I'm working on. I'd like to begin by telling you a little bit about the client. I'm presently working with a client who is a victim of intimate partner violence or domestic abuse. Her name is Barbara, and she's a 43-year-old Afro-American female who is married, has been married for the past 20 years. Barbara has 3 children. Their ages are one son, who is 19, and 2 daughters, ages 17 and 14. Barbara is a high school graduate, whereas her husband, on the other hand, has only a 10th grade education. He is presently employed, but a lot of times he doesn't find work through the temporary agencies. So a lot of times he's at home. He's also an alcoholic, as reported by his wife Barbara. And it is at these times when he's drinking that he becomes abusive, not only towards Barbara but also towards their children if they should try to intervene. Barbara presently has no employment background or history. She's never maintained a job because she had her children very young. However, she is very intelligent. She has one very good girlfriend that she's known since her years in high school. She doesn't see her friend very often, merely occasionally, and most especially around the holidays. However, this friend is aware of her abusive situations, and she has offered Barbara refuge at any time she feels that she can no longer exist in her present environment or can no longer deal with the abuse. She's welcome to come to live with her friend, as well as bring her children along. The theory that I'm working on is the emotional family systems theory, and the intervention that I've chosen for this presentation is psychotherapy, psychoanalysis. This is a theory that has been integrated along with a lot of other theories in working with various populations. The family systems theory is one that is predominantly prescribed for persons who are members of a family, and the intervention of psychotherapy, psychoanalysis is one that is designed to work with the individual, but in the context of the family. Barbara has expressed, a desire for change. She is afraid for herself as well as for the safety of her children. However, she's also afraid because if she believes if she tries to seek outside supports, that her husband will hurt her or harm her or her children to a greater extent. She's afraid of reprisal from her husband. However, I met Barbara by way of the hospital that she attended after having been beaten once again by her abusive husband. The social worker at the hospital contacted our agency, and we were more than willing to work with her. Since having met her, she has presented herself to be somewhat confused about her situation, because on one hand she expresses the desire for change, but on the other hand she speaks of her fears of not having a place to go, not having monies to raise her children or to care for her children. And when I asked her if she's worked with any other agency, she's expressed that she hasn't, because where she lives, all the agencies are predominantly located downtown, and on most days she doesn't have monies to get to these agencies. And again, she's also afraid that if her husband should find out that she's even in contact, that if she's even in contact with any of the outside agencies that are capable of helping her, that once again her husband would definitely become very angry with her to the point of causing her physical harm. The intervention that I've chosen to use in relationship to this theory is the psychoanalysis psychotherapy intervention. This was an intervention that is used predominantly within the family context with the population of those who are domestically abused. I believe that this intervention would prove valuable in assisting Barbara in becoming aware of her tendency or her behaviors of acceptance and tolerance for this abuse against her for as long as she has. This was psychotherapy or psychoanalysis was introduced to us by psychologist Sigmund Freud, and he was a firm believer in that based upon our past experiences, our behaviors, attitudes, and thoughts are shaped. In speaking with Barbara, I have learned that she is a victim of intergenerational abuse. She recalls witnessing the violence perpetrated against her mother, as well as her mother shared with her experience of witnessing her father, in turn, beating her grandmother. Anyway, I've asked Barbara to come in so that we can begin employing this intervention, and I truly believe that it would prove to be a great help to her. Also, as I've learned, some of these interventions are best used when integrated with other theories and interventions. So I also firmly believe in the CBT therapy as an intervention. But right now I'd like to introduce you to my client, and her name is Barbara.